Welcome to the deep dive. Now, usually we take a couple of sources and really pull them apart for you, but today we're doing something a bit different. We're looking at a real giant in its field, the 10th edition of Rutherford's Vascular Surgery and Endovascular Therapy.
Really is the benchmark text, isn't it?
Absolutely. So think of this as a guided tour, an overview of what's inside this massive book. If you're in vascular medicine, maybe research, or honestly, if you just want a proper understanding of the field, this is for you.
Exactly. And it's huge. It covers, well, everything from the basic science, how things work and how they go wrong, right up to the latest surgical techniques and endovascular treatments.
So our plan today is to give you a kind of structured walkthrough, hitting the highlights, showing you the scope of what Rutherford's offers.
Yeah, roadmap, basically. The book itself has all the intense detail, obviously. We're just giving you the lay of the land.
Okay, let's dive in. The book starts, quite rightly, with the fundamentals, the science behind it all. And one thing that jumped out at me was the role of cholesterol crystals. It's more active than just clogging pipes, right?
That's a really key point, and the chapter on the pathobiology of atherosclerosis goes right into it. It explains how these cholesterol crystals aren't just passive bystanders. They actually trigger something called the inflammasome.
The inflammasome, okay.
Yeah, it's part of the immune response. And activating it ramps up these pro-inflammatory signals like IL-1 and IL-18. So the crystals themselves are actively fanning the flames of inflammation inside the artery.
So it's not just buildup, it's an active inflammatory attack prompted by the cholesterol itself. And the book mentions some animal studies.
Right. Studies in LAR mice, which are, a standard model for this kind of research, they show that if you block those inflammatory pathways, even if cholesterol is high, you get less atherosclerosis. It really drives home that inflammation is a key player on its own.
And that links into biomarkers, doesn't it? Like HSCRP, the high-sensitivity C-reactive protein.
Absolutely. The chapter on biomarkers in vascular disease talks about HSCRP being a really strong predictor of cardiovascular events, sometimes even more so than cholesterol levels alone.
Which brings us to the Jupiter trial, which the book discusses. This one really shook things up a bit, didn't it?
It did, because Jupiter looked at people with normal LDL cholesterol, the bad cholesterol, but high levels of inflammation, indicated by HSCRP.
Okay.
And it found that giving them a statin, rosuvastatin, significantly cut down their risk of major heart problems, strokes, and needing procedures like bypass or stenting.
So the takeaway is you can't just look at cholesterol. Inflammation matters, even if the LDL looks okay. And statins might help tackle that inflammation risk.
Precisely. It broadened our view of who might benefit from statins. It's key insight from that biomarkers chapter.
Okay, interesting. Now, the book also gets into the nitty-gritty of how vessels react to injury and flow, the chapter on vascular biology and hemodynamics.
Yes, it covers preclinical work like studies in pigs, looking at what happens after vascular injury. They discuss how certain immune cells, monocytes, and this specific protein, fibronectin E, contribute to that thickening inside the artery, the neointimal hyperplasia, which can cause problems after procedures like angioplasty.
And it's not just injury, but also the actual forces of blood flow.
Exactly.
Yeah.
The chapter explains how ischemia or perfusion, cutting off blood flow then restoring it, affects the endothelium's response. And it talks about shear stress.
Right, the difference between smooth flow and turbulent flow.
Yeah, steady laminar shear stress, which is the smooth flow in healthy vessels, seems to be protective for the endothelial cells. But oscillatory shear stress, the more disturbed flow you get near blockages or branches, that tends to promote inflammation and oxidative stress. It affects the cell's redox state, that balance of damaging molecules and antioxidants.
So the way the blood flows really matters to the health of the vessel lining.
It does. And the chapter also mentions things like tetrahydrobiopterin, which might help reduce that ischemia reperfusion injury by influencing those redox pathways.
Fascinating stuff. Okay, then there's the chapter on arteriogenesis and angiogenesis about growing new blood vessels. Super important when arteries get blocked off slowly.
Absolutely vital. It explains how the body tries to compensate by growing new pathways. Arteriogenesis is about enlarging existing collateral vessels, while angiogenesis is forming new capillaries. The chapter details the growth factors involved, like CSF1, chemokines, and also the role of endothelial progenitor cells coming from the bone marrow.
And you can't discuss vascular issues without clotting. The chapter on hemostasis thrombosis and antithrombotic therapy.
Essential reading. It puts thrombin right at the center of the coagulation process. Thrombin doesn't just make fibrin for the clot structure, it also activates factor 13 to stabilize the clot, and influences many other parts of the system. It's complex.
And finally, for this foundational section, there's a chapter on environmental factors and vascular disease. What kinds of things does that cover?
Well, it brings in external influences. There's growing evidence linking air pollution to faster progression of coronary artery disease and calcification. It also touches on more debated topics, like potential links between mercury exposure, fish oil intake, and cardiovascular outcomes. Lots still being researched there.
Okay, so a really solid scientific base. Then the book shifts gears into how we actually diagnose vascular problems, the diagnostic techniques section.
Right, starting with the basics in non-invasive physiologic testing. Things like measuring the ankle brachial index, pulse volume recordings, exercise tests, fundamental tools.
And then imaging. Duplex ultrasound gets its own chapter, naturally.
It's the workhorse, really.
Mm.
Great for seeing vessel structure and blood flow in real time. The chapter covers how we use it to check surgical connections, measure flow in grafts, but it also points out limitations. Sometimes certain graft materials can make it hard to get a clear image.
And for getting into the vessels for procedures, there's vascular access techniques.
Yeah, crucial stuff. How to safely access arteries and veins, like the internal jugular or femoral vein. Big emphasis on using ultrasound guidance now, and sometimes doing a venogram first to check for clots before putting in larger sheaths for endovascular work. For more detailed pictures, magnetic resonance angiography, MRA, is covered in its own chapter too. Yes, magnetic resonance angiography and magnetic resonance phonography. It explains how MRA works, using contrast for 3D views in conditions like vascular thoracic outlet syndrome. Also mentions MRI for checking kidney transplants or looking for inflammation in large vessel vasculitis like Takayasu arteritis.
And we can even look inside the vessels now with IVUS, intravascular ultrasound.
Right, the intravascular ultrasound chapter highlights what IVUS adds. It's great for precise measurements, like figuring out how narrow a vein really is or checking for compression in thoracic outlet syndrome. Also very useful for looking closely at plaque in arteries and assessing how well stents have been placed. It even mentions using pressure wires, like renal fractional flow reserve, during angiography to see if a kidney artery narrowing is truly significant.
Of course, using contrast dyes comes with risks, which are covered in contrast nephropathy and contrast reactions.
Important chapter. It discusses the risk of kidney injury from contrast, who is most vulnerable, and importantly, the strategies we use to try and prevent it. Plus, managing allergic type reactions.
And for venous issues, there's venography and invasive venous studies.
Yes, covering techniques like descending venography to look specifically at venous valve function and reflux, which is key in understanding varicose veins and chronic venous insufficiency.
Okay, quite a toolkit for diagnosis. Now, the really big part of the book, management of arterial disease, starting with the aorta and the legs.
This is the core, really. So many chapters here. It kicks off with open surgical techniques. Open surgical exposure of the aorta and its branches, details approaches like left medial visceral rotation to get to those tricky visceral arteries.
And different ways to actually make the incision for aortic surgery are in open surgical treatment of thoracic and abdominal aortic aneurysms.
That's right. Discusses transverse, subcostal incisions versus the traditional midline, depending on what part of the aorta you need to reach. Then there's laparoscopic aortic surgery, covering minimally invasive options like aortobifemoral bypass, placement of ports, and the potential advantages.
When doing bypasses, the graft itself is critical. Pathobiology of vein graft failure sounds important.
Very. It explains why vein grafts sometimes fail over time, changes in the vein wall narrowing. Understanding this helps choose the right graft and manage patients afterwards.
And the book compares the different graft choices.
Yes, in inguinal bypass grafts, autogenous vein focuses on using the patient's own vein saphenous, arm vein, which generally have the best long-term results in the legs. Then, in inguinal bypass grafts, prosthetic grafts cover synthetics like PTFE and Dacron when vein isn't an option. There's even a chapter on unusual bypass grafts, like bovine carotid artery.
And of course, loads on endovascular techniques, peripheral arterial stenting and angioplasty.
Covers the basics of balloons and stents, the different types, like balloon expandable versus self-expanding, and where you'd use each. Also practical points, like needing guiding catheters for placing certain stents accurately.
For aneurysms, EVA or endovascular repair is huge now, addressed in endovascular abdominal aortic aneurysm repair.
Definitely. A big focus is on accurate sizing, especially for tricky anatomy like angled or short necks. The chapter details how to measure properly and critical steps during deployment, like getting the limbs seated correctly in the iliac arteries to prevent leaks or migration. Similar detail is in thoracic aortic aneurysms and dissections. Endovascular management for the chest aorta.
The book also looks at why aneurysms happen in chapters like thoracic aortic aneurysms and dissections, open surgical management, and genetic aspects of aortic aneurysms and dissections.
Right. These cover the open surgical options, but also the genetic links we know about, like mutations in ACTA2 or MYH11 genes, and the ongoing search for biomarkers to identify people at risk earlier.
And it discusses specific devices, too, like in fenestrated and branched endografts for complex aortic aneurysms.
Yes, it gets into advanced devices like the Zenith Fenestrated Graft, ZFEN. These have custom openings, fenestrations, or scallops to allow continued blood flow to critical branches like the kidney or gut arteries when treating aneurysms close to them. It also mentions specific thoracic devices like the Medtronic Valiant Navion system, noting its lower profile design.
Moving down the leg, exposure of the femoral artery and its branches guides surgeons.
Crucial anatomical detail there, especially emphasizing how important it is to protect branches like the profunda femoris artery during surgery, as it's a major blood supply to the thigh.
And assessing how bad the leg ischemia is. The WIFI classification in lower extremity arterial occlusive disease, clinical evaluation, and non-operative management.
Exactly. WIFI stands for wound, ischemia, and foot infection. It's a staging system that helps predict the risk of amputation and guides treatment decisions. It's become quite standard.
And then there's acute limb ischemia for sudden blockages.
Yeah, the true emergency. That chapter covers causes, how patients present, and why rapid diagnosis and treatment are so critical.
What about balloons and stents for severe chronic leg ischemia, like in endovascular therapy for chronic limb-threatening ischemia, infranguinal disease? It mentions drug-eluting balloons, DCBs.
Yes, there's discussion about the role of GCBs versus plain balloons.
Mm-hmm.
DCDs might reduce restenosis, needing fewer repeat procedures, but the evidence on whether they actually improve limb salvage or long-term survival compared to plain angioplasty and CLTI is still debated and evolving.
And leg ulcers are covered in management of lower extremity ulcers.
Right. Differentiating the cause, arterial, venous, neuropathic, is key based on history and exam to guide the right treatment.
What about injuries, management of vascular trauma, and specifically management of venous injuries?
Essential chapters for trauma surgeons, general principles, and specific advice for veins trying to repair them if possible, especially major ones, maybe using a patch to avoid narrowing rather than just tying them off.
And before any big vascular operation, perioperative cardiac risk assessment and management is vital.
Hugely important. Using risk scores, biomarkers like BNP, managing medications like statins and blood pressure during the operation to minimize cardiac complications. It notes the link between low blood pressure during surgery and poorer outcomes.
Also related chapters like antithrombotic therapy and vascular disease, on blood thinners, congenital thrombophilic states, on clotting disorders, and even details on specific clotting factors like EA in hemostasis, thrombosis, and antithrombotic therapy.
Yes, it really covers the pharmacological side thoroughly too, including antiplatelet drugs like aspirin and dual therapy, and the underlying clotting system.
Wow, okay. That's a massive amount just on aorta and legs. What about the neck arteries, the carotids, and vessels going to the arms and head?
Yep, another major section starts with carotid artery stenosis, clinical evaluation, and non-operative management, then delves into treatment with carotid endarterectomy for surgical removal of plaque, and carotid artery stenting for the endovascular approach.
What kind of detail is in those?
Things like the ultrasound criteria used to decide how severe the narrowing is, the evidence comparing surgery versus stenting, outcomes after redo surgery, and even how the specific design of the stent might impact results. Also mentions tailored antiplatelet therapy based on testing.
And acute stroke treatment.
Absolutely the critical chapter. Endovascular therapy for acute ischemic stroke. Covers the techniques for pulling out clots, thrombectomy, and the concept of mismatch identifying brain tissue that's at risk but potentially salvageable.
Less common issues are covered too.
Yes, like carotid and vertebral artery dissection, managing tears in the artery wall, and vertebrobasilar insufficiency in vertebral artery surgery, discussing bypasses for problems with the arteries at the back of the neck.
And the big vessels coming right off the aorta arch.
Covered in superaortic trunk disease, open surgical management, detailing bypass procedures like aorta to carotid or subclavian grafts, and superaortic trunk disease, endovascular management, which focuses on stenting lesions in the innominate or subclavian arteries, discussing patency rates and techniques.
Goodness, still more sections? Other vascular conditions. This sounds like a catch-all.
It is, but it covers really important areas. Things like thoracic outlet syndrome, compression of vessels or nerves at the shoulder, focusing on arterial complications and diagnosis, using CTA with arm maneuvers.
What else is in this section?
Okay, renovascular disease, mainly about fixing kidney artery stenosis. Popliteal artery entrapment syndrome, where the artery behind the knee gets squeezed. Subclavian and axillary vein thrombosis, clots in the arm veins. Raynaud's phenomenon and upper extremity ischemia, dealing with vasospasm and blockages in the arms, including surgical options like sympathectomy.
Seems very comprehensive.
It keeps going. Upper extremity replantation and amputation. Vascular malformations, distinguishing AVMs from AVFs and how to treat them. A big focus on venous thromboembolism, so DVT and PE diagnosis and treatment, including risk scores like Wells, anticoagulation options, and even catheter-directed thrombolysis for acute DVT.
What about more common venous issues and lymphatics?
Yes, varicose veins and telangiectasias, covering sclerotherapy, ablation, compression, and lymphedema, explain the different types, staging, and treatments like compression therapy and surgical approaches.
And areas like dialysis access and trauma again?
Right. Vascular access for hemodialysis, creating and maintaining fistulas and grafts, and crucially, how to deal with clotted access using endovascular techniques. Traumatic vascular injuries revisits trauma, but maybe focuses on specific vessel locations or mechanisms.
It even covers kids.
Yes, pediatric vascular surgery addresses unique issues like congenital aneurysms, injuries during pediatric procedures, which are often related to vessel size, and how to image kids. Also touches on complex regional pain syndrome, which can sometimes follow injury or surgery.
And finally, it looks at how practice is changing.
Exactly. Chapters like telemedicine and vascular surgery, which obviously became much bigger recently, discussing the benefits for access and cost, and social media and the vascular patient, looking at the quality of online information and guiding patients to reliable sources.
Wow. Okay, that was a whirlwind tour, but I think it really paints a picture of just how much ground Rutherford's 10th edition covers.
It really does. We've sort of skimmed across the surface of dozens of chapters, but hopefully you get this sense of the incredible breadth and depth. From the absolute basics of vascular biology right through to highly specialized surgical and endovascular procedures for almost any vascular condition you can think of.
It's clear why it's considered such a cornerstone text. If you're in this field, it seems like an indispensable resource, covering both the foundations and the very latest developments.
No question. And, while this overview gives you a taste, the real value is in the book itself. For any specific topic we touched on, the detail, the nuance, the evidence, it's all laid out in those chapters.
So if you need the deep dive on any particular aspect of vascular surgery or endovascular therapy,
you need Rutherford's. This overview is just the starting point. The book itself is where the real in-depth knowledge lies. It truly is a monumental work.